So we do internal fixation when non-operative treatments fail or early mobilization is required. जिसमें हमारे पास unstable अगर fracture हो, pathological हो या multiple fractures हो, तो we will internally fixate it. We need to use operative techniques in order to fix it. So इसमें हमारे पास क्या-क्या methods है. So this is important. Screws and plates for absolute stability, such as compression plates. So the plate is attached along the long bone. So look here, it's attached along the side of the bone surface, and the plate is then attached by screws. ठीक है, so ये screws हैं, ये screws हैं, ये screws हैं, ठीक है? And the screws compress the bone fragments together, and it helps primary bone healing without callus formation. ठीक है? So these are screwed in. And then K wires are temporary fixation, often for children or small bones. So ये एक हम wire ले लेते हैं, temporary fixation होती है, and this is for children or for small bones. And then intramedullary nails are load-sharing, minimally invasive, early weight bearing के लिए ये allow करता है. So it's basically intermedullary का मतलब क्या है कि it's in the medulla and it's a nail. So a metal rod is inserted into the medullary canal, so the center of the bone, and it shares the load with the bone and allows early weight bearing. So वो सिर्फ bone के ऊपर weight नहीं पड़ेगा, इस nail के ऊपर भी पड़ेगा, ठीक है? And it supports the bone from the inside. And then we can also use interlocking screws, aka interlocking IM nails at both ends to prevent rotation and shortening. So I just want you to think about like this is the long bone, and for example ये यहाँ से टूटी है, so we insert a rod in between, and हम इस side पे भी एक intermedullary nail लगा लेंगे या interlocking IM nail, यहाँ पे भी interlocking screw वो हो जाएगा, जिससे क्या होगा, rotation भी रुकेगी कि ये rotate ना हो जाए और shorten ना हो जाए. So this is used for diaphyseal shaft fractures, and that makes sense क्योंकि हम medulla को stabilize कर रहे हैं. So dynamic compression plates जो कि यहाँ पर होते हैं, where are these? These are special types of compression plates. हमने यहाँ पे compression plates की बात की थी ना, plates की बात की थी. So like this is a special type of plate. This is a special type of plate जिसमें हमारे पास क्या होता है, which allows axial compression along the fracture. ठीक है? So it allows कि ये axis है, and it यहाँ पे dynamic compression plates allows axial compression. And then interlocking IM nails are standard for diaphyseal fractures. ये यही वाली बात यहाँ पे होगी. And then lag screws. These are lag screws provide interfragmentary compression. So what that essentially does is there's a special screw that compresses the two fragments together, right? And it's used with plates. See? So like very easy. It's just screws and plates to get a plate is along the shaft of the bone, and then the nails hold the screws compress the bone fragments together to get without callus formation. And then K wires are just wires that are supposed to um for small bones and children. And then intramedullary nails are within. This is for like जो diaphyses का fracture होता है long bones का, ठीक है, femur, tibia, humerus वगैरह का. और interlocking nails हम either side पे दे देते हैं ताकि rotation ना हो या shortening ना हो. And then उसके बाद dynamic जो compression plates हैं, it's a special type जिसमें axial compression होता है. And then lag screws हम डालते हैं दो उसमें, ये it provides it joins both of them fragments together. And then external fixation is just from the outside, okay? So why do we use it? We use it in open fractures, for example, where we want to stabilize it from the outside in an infection, bone loss, or polytrauma. So there's just so much trauma, okay? You need external fixation because it's just too much operation, bone loss, agar ho infection ho. So it's easy for like the wound, wo जैसे हमने ये wound यहाँ से cover कर लिया है, and it's adjustable and it allows rapid stabilization. So you don't have to go into surgery, you could just do it rapidly. But the disadvantage is कि of course like ये contact में आएगा तो it'll lead to like pin track, ये जो pin का track है ये infect हो जाएगा. It's cumbersome, it interferes with soft tissue handling. So a fracture is suitable for non-operative treatment. So which ones? So it's the clavicle. When the clavicle fractures, you can just like you don't have to operate. You can just use closed mechanisms, scapula, right? And then undisplaced tibia, fibular or pelvic fractures, and then phalangeal or metatarsal. So just think the clavicle, right? So this, and then the clavicle is attached to the scapula. So this is here. And then think about the hands. And in the hands, it's the phalangeal and metatarsal to get. And then when you think about the long bones, you're just going to think undisplaced or so undisplaced fractures. So when the articular surfaces are still articulating with one another, then you don't have to use, you should not use open operative techniques. So unsuitable, it's open fractures, of course, and then failed conservative treatment. Now you have to do it intra-articular fractures, non-union or malunion, or type 3 to 5. Why? In Soldier Harris, because the growth plates are affected.